Breaking the Wall of Painful Palatal Healing. Nick Madihah, Nick Azis. Falling Walls Lab, Kuala Lumpur.
Hello. Good afternoon. What if I told you that the most painful part of gum surgery, it is actually not at the gum itself. It is where we harvest the tissues from. Every year, thousands of patients undergo gum surgery, while the gum, the site of the surgery, tends to heal beautifully. But the area where we take the tissues from, which is the palate, is left with a raw and exposed area. This raw and exposed area can cause prolonged pain, bleeding, and impaired function. Today, dentists such as myself worldwide standardly place collagen dressing from an animal origin. This collagen sponge is harvested from animals and placed to cover the exposed area. While it tends to work, it comes with three different problems. First, the cost, and the cost can be prohibitive for many populations. Second, the environmental cost, the cost of harvesting this from the animals, sterilizing, processing, packaging, sending it all away out. And the third, the most important one for my population, is the cultural beliefs, where some people from the different ethnicities and cultures do not actually accept having animal-based biomaterials in their mouth. So, we need a solution that is, 1, affordable, 2, culturally acceptable, and environmentally safe and green as well. And our idea is simple. It is to reuse what we already have. In our double-blind randomized control trial, we recruited 36 participants. For the control group, they used the standard collagen plug dressing from an animal origin, while for the test group, we used the tissues harvested from the palate, sliced it into two parts, the epithelial part and the connective tissue part. And the connective tissue part, we reuse it to build the gums where we wanted the surgery to be done. But the epithelial part, which is usually discarded as medical waste, we used this back and sutured it back to the palate, somehow like a natural dressing or natural bandage. So the outcome, it was first, certainly more effective than the old collagen plug from animal origin. Second, patients had less pain and better functional recovery. And the outcome is certainly better. The test group performed better than the control group. So while we developed this technique specially for gum surgery, this principle of recycling one's own tissue to use in other parts of the body can one day transform how we manage wound care, for example, in burns patients, accidents, or other injuries. By breaking this wall of wound care, we aim to make wound care kinder, acceptable, sustainable, and more cost-effective. Our vision, healing powered by the body itself, nature's own bandage. Thank you.